Welcome back to Inside South Florida. If you're thinking about plastic surgery for health or cosmetic reasons, there are some great new techniques happening right here in South Florida. And here's board-certified plastic surgeon Dr. Jeremy White to tell you all about them. Dr. White, it is awesome to have you on the show. How are you?
I'm doing fantastic. Thank you for having me today.
It's my pleasure. We have some really cool stuff to talk about. And what's so interesting about this is that there are a whole bunch of great technologies available to South Floridians that they can get. One of the places they can get them is from you, right?
That's right. And there are certain things I'd like to share with you guys today that a lot of people are not doing down here. And a lot of the, for instance, the first thing I'm going to talk about with non-surgical ear molding, a lot of the pediatricians don't even know about it. So I'd like to get the word out today and let everyone know that there are certain options even for little babies that can be covered by insurance.
So I know just from talking to you that you're really excited about some of this new ear technology, right? And,
I am.
And how it can help babies and youngsters, and so talk about it.
Okay, so what I've been doing in my practice is non-surgical ear molding, and what that is for babies who are very young, so newborns, in their first couple days to weeks of life. About 15% of children that are born have some kind of ear deformity, and this can range from a large spectrum of things. About 30% of the time, for certain cases, these self-correct, but we don't have no idea which ones are going to self-correct.
Sure.
So instead of taking the chance of just watching and waiting and allowing these children to be teased in school and be obsessed with their ear deformities up till they're about 5 or 6 years old. Beforehand, there was really the only other option was to wait till they were 5 or 6, and if it meant enough to the child and to the parents, then I would do an otoplasty, which is a surgical procedure. It's outpatient, and it's sort of the ear pinning. Well, I can accomplish a lot of the same things non-surgically as long as they're under 6 weeks of age, and the earlier that I see them, the better. There are better results when I start the process when they're less than 3 weeks old.
Okay.
And if I see them even earlier, within the first 48 hours of life, I can shorten the process.
Again, just because I know you personally and I know how excited you are about this. All right, so a couple minutes left. Let's talk about new devices and techniques for breast augmentation.
Okay.